So, as a nurse, I approach the Hernandez family using a holistic and patient-centered framework that considers social determinants of health, prevention, and care coordination. So, the first question I'm going to be answering is how should care models adapt for underserved multi-generational families? So, from a nursing's perspective, care must adapt to the patient's real life circumstances. For example, Doña Elena's unmanaged diabetes and hypertension are not due to the refusal of care, but rather due to the barriers of not knowing the English language, transportation difficulty, and reliance on home remedies because the healthcare system is inaccessible and unfamiliar. And because these healthcare remedies are what she knows best, she's going to stick to it. Rose's situation also shows why traditional clinic models fail underserved families. She works two part-time jobs, and without benefits, it makes it difficult to attend appointments, as well as follow strict medication schedules and maintain diet recommendations. If a treatment plan does not fit a patient's daily life, adherence will be low regardless of their motivation. So, nursing interventions focus on accessibility and understanding. As nurses, we assess social determinants of health at each encounter, provide bilingual education, and we can also use a teach back method to confirm patient understanding. So, community-based approaches like the Raíces Saludables mobile bilingual clinic are especially effective because they bring healthcare into the neighborhood. When nurses respect cultural practices and ask about home remedies instead of dismissing them, trust improves and patients are more likely to participate in care. Ultimately, nursing care is effective only when the patient can realistically and obtain the plan. Second question is, how do health needs differ across generations and how should interventions respond? So within the Hernandez family, there are three generations, and we have to consider each lifespan's health needs. For example, with Doña Elena, the priority is chronic disease management. Nursing care would focus on blood pressure and glucose monitoring, medication teaching, and simple education appropriate to her health literacy level. For Rosa, the concern is early onset chronic disease related to stress and financial instability. Nursing care would emphasize medication adherence, realistic nutrition counseling using affordable foods, and stress management rather than an idealized lifestyle advice. Lastly, the teenagers represent the greatest opportunity for prevention. They face chronic stress due to their living situations, academic pressure because they're in school, and limited access to mental health services. Therefore, nursing interventions would include school-based education, mental health screening, and teaching coping skills and healthy habits. Without prevention at the adolescent level, chronic disease continues across generations. Nursing practice therefore prioritizes early education and health literacy to break this cycle. So, for example, to the teenagers, we would refer and collaborate with guidance counselors and school counselors as well. Lastly, the last question is, how does teamwork improve community outcomes? As nurses, we play a key role in the interdisciplinary collaboration and care coordination. We are the main point and we communicate with almost all the healthcare professionals. For example, healthcare providers diagnose and prescribe, but long-term outcomes depend on addressing their social needs. For example, a doctor can prescribe insulin, but alone it will not control diabetes if the patient cannot afford healthy foods and they have a lack of transportation to their medical appointments. As nurses, we connect families to programs, community resources, and social workers who assist with housing and insurance enrollment. School counselors, as discussed in the previous question, can identify mental health concerns early, while public health programs provide screenings and prevention education. The Raíces Saludables initiative works because it combines medical care, mental health, support education, and community resources in community outreach. Nurses function as the central link among these services, ensuring communication and continuity of care. To include, the Hernandez family demonstrates how social determinants of health create intergenerational disparities. From a nursing perspective, improving outcomes requires culturally competent education, prevention across the lifespan, and strong care coordination. By addressing both medical needs and social conditions affecting health, nurses can help families move from reactive treatments to long-term health and wellness. Thank you.